Chastity Torres, and I'm going to be performing. Oh, I'm student one, and I'm going to be performing a rotary on T6. So I'm going to go in, find T6. My contact hand is going to be my inferior hand, and my stabilization hand is going to be my left hand. And I'm going to be on the posterior inferior aspect of the TVP. And my right hand is at 11 and my left hand is at 2. So then I'm going to do a square stance. My inferior hand is at 12, superior hand is at 3. I'm going to finish with my inferior hand at 1 and superior hand at 4. The line of correction was P to A, I to S along with the 60-degree angle of the set with a clockwise torque. So my next adjustment is a pro index pillar push contralateral. We're going to potentially has a left rotational restriction on support. So I'm going to be taking my tissue pull. I'm going to ask her to turn her head to the left. I'm going to do slight traction, I to S. My forearm is going to be 45 degrees. And then my line of correction is P to A along the plane of the disc. So this is going to be a supine hypothenar mastoid push. I'm going to potentially has an LPS. So I'm just going to basically stabilize her with my right hand using the calcaneal aspect of my hand and fingers. I'm going to turn her, and I'm with my left hand, I'm using my hypothenar. I'm coming straight down right here. I'm going to bring her back to neutral. I'm going to do 5 degrees of flexion and then rotation, and I'm going to go in that direction. So my line of correction would be P to A, S to I, left to right. Being a seated anterior thoracic of T6, I'm going to be using my left hand as my contact hand. I'm going to be doing hypothenar, thenar, distal phalangeal bilateral. I'm going to be contacting T7 on the posterior inferior aspect of it. And my line of correction will be A to P, I to S along the 60-degree angle of the sets. Okay. So what I'm going to have is I'm going to stand on her right side. And then this hand's going to go above, this one's going to go under. So I'm going to find T6, T7. So I'm going to have you tuck your chin and then take a deep breath in. Let it all out. It's a seated digit TVP pull. We're going to potentially have a right rotational restriction. Okay, so my contact hand is going to be my right hip and dip of my middle finger, my chiropractic finger, and then my stabilization hand is going to be the inferior tip of my left on the mastoid with slight I to S traction. And then I'm going to go slide here, rotate, and bring in. My line of correction is P to A, I to S with the clockwise rotation.